Welcome to Western Oregon Living. I'm your host, Sabrina Reese. Today we're at Mercy Shaw Heart and Vascular Center. Let's go meet Dr. Howard Feldman. Good morning, Dr. Feldman.
Hi, Sabrina. Thanks for coming to the Shaw Heart and Vascular Center. How are you?
Good. What is your background in vascular?
Well, I do what's called interventional cardiology. I've been doing procedures to open arteries in the heart since about 1978. And then in recent years have extended that same model for treatment into the lower extremities, the arteries to the kidneys, the arteries to the brain. It's pretty much the same disease. It's the same batch of tools that we use. And so we found it's equally effective to use these elsewhere. But today I want to talk to you about amputation prevention, which is a principal focus for us here at the Shaw Heart and Vascular Center. We in fact do more of this than most places in the Northwest and in fact in the country.
How long has this been available in Roseburg?
We've been doing amputation prevention here for several years. I came here in 2006 to start the heart program and began to develop this element of the program a few years ago because there's such a strong need here for that. We have a population that's at risk for amputation, lots of diabetes, lots of cigarette smoking, lots of hardening of the arteries to the legs, which is what this is based on. Here is a patient who had a severe narrowing and in fact a total blockage of this artery going to the leg right here.
So what's this?
This is the superficial femoral artery and it's filled with x-ray dye. You can see it should be big and plump like this, and it narrows down and is actually absent here with just a trickle of flow beyond to supply the entire leg below. After procedure such as we talked about, which can be a very brief procedure under local anesthesia through an incision that's about that long, we have an artery that looks like this, and I thought I'd show you some of the tools that we use to achieve these results. What we do is we enter the artery with a little needle, very, very small needle under local anesthesia, the same anesthesia that the dentist uses when he works in your mouth. It's sharp, okay? Once we get into the artery, we have blood flow. We put this little guide wire through it and pass it up into the artery like this. And then we pass a sheath like this into the artery over a wire. The wire stays inside the artery and the sheath tracks over the guide wire.
Is this the...
And this is the outside of that right there, you see?
Oh, wow.
Right. This is what we work through. This gives us what's called a platform to work through. It gives us the support we need. We put a guide wire, again, like the one I showed you, across this narrowing through the sheath, and then we dilate this artery with this balloon. I'll let you hold this. We have something that actually allows us to put pressure into the balloon, and as the balloon inflates, it pushes this plaque back against the wall to leave the artery open. Because these arteries can recoil, we have this little stent that we can put in. This is actually a stent graft. And we can put it right in here where the narrowing was to keep the artery open. It gives us a predictable large tube for blood to flow through. And so we have now restored flow directly to the foot. This particular gentleman also had a lot of disease that looked a lot like this all the way down into the foot, and we had to go down into the foot with very, very tiny implements to open the arteries in the foot. Now, we can actually enter the arteries in the foot using a very tiny sheath. You can see the difference in size between this one and this one, reflecting the difference in the size of the arteries that we use or have to deal with. And this is called pedal or foot access.
What's the recovery time after a procedure like this?
Well, recovery basically depends on how much disease we're dealing with. If people have open wounds, they heal much, much faster when blood flow is restored. So it can take weeks, but consider the option, which is amputation.
Thank you so much for watching, and please continue to watch Western Oregon Living to see what else Western Oregon has to offer you.